Now, there are 6 mistakes that you can make when you develop a viral infection and you're going to actually address it or treat it that I want to talk about. Because when you start getting sick, especially a viral infection, you want to make sure that you can maybe fight it off initially so it doesn't develop into a full-blown infection. And if you have the infection, you want a very quick recovery. You don't want something that's going to last a very long time. So this video is going to be very important. All right, number 1, stopping a fever too quickly. There's this impulse to want to get rid of your fever, especially if a child has fever. Well, did you realize that by getting rid of the fever, you're going to prolong the duration of the infection? You have to realize what that fever is there for. Very, very important. It is there to help reduce the spreading of the virus. That's right. Like if it's in your sinuses down into the lungs. It can actually inhibit the spreading from the lungs throughout the rest of the body. It can reduce the reproduction of the virus. It helps inhibit the virus going into the cell. It reduces something called IL-6, which is a requirement for the virus to survive. And on top of that, the fever increases your T killer cells, which is everything to do with killing off viruses as well as killing off cancer. In fact, when you start getting a fever, I would recommend do things to keep really, really warm to help enhance that fever. You know, when you're actually sleeping, just wear more clothes, have more blankets, take a hot bath, take a hot shower, stay really, really warm. Viruses hate heat. All right, number 2, taking an antibiotic for a virus. It doesn't work. Antibiotics only work for bacterial infections, not viruses, not fungal infections, not candida, only for bacterial infections. And the problem when you take an antibiotic, there's some slight minor complications. And I'm being very sarcastic because there are a lot of side effects. The big one being, you know, when you take an antibiotic, you're not going to fully kill off everything, right? Those microbes that survive become stronger. They start resisting that antibiotic. They learn from that stress. And now the next time you use an antibiotic, it doesn't work anymore. And then you get sick and you have another infection, another infection. So over time, these antibiotics become less and less effective, not to mention all the other side effects. So when you have a virus infection, antibiotics don't work. And if for some reason you have to take an antibiotic, make sure you also take a probiotic at the exact same time so you can actually kind of preserve your own microbes to some extent. I mean, the reason I'm even bringing this up is because literally like 50% of all antibiotics are prescribed unnecessarily. Also, if you take antibiotics, you end up with a severe B1 deficiency, which creates all sorts of issues. Now, the next one is just a kind of concept of avoiding over sanitation. And this has to do with something called the hygiene hypothesis, mainly for kids that are living in a very super clean environment. They tend to get more allergies. They tend to get sick more often simply because they don't develop an immune system. You have to realize that, especially early on when you get an infection as a child, that's the training of your immune system. So sometimes we have this obsession to keep everything so sterile and clean and sanitized. Well, that can inhibit your immune system as well, especially if you are sanitizing your hands or your skin. You actually are wiping off all the good bacteria that live on your skin as well. I mean, this also can relate to facial cleansing creams and scrubs and all this work to kind of clean your skin, whether you have acne or whatever. You're just stripping off all these friendly bacteria and you end up with rashes on your skin, and the skin is not as healthy. All right, number 4, detoxifying. When you run down or you're getting sick, you don't want to do a detox. You don't want to take things that detoxify you because that's going to weaken your system. You're going to actually probably even get sick just from that. I've been completely, without symptoms, right? I had no infections. And then I took some remedy to detoxify myself and I ended up with a full-blown infection. Now, what is going on with that? When you detox sometimes incorrectly, you release a lot of crud and stuff and it creates an immune reaction. And you can even be sick just from that. Not to mention, you can weaken the immune system and activate latent viruses that are dormant. So the point is, when you're sick, you want to nurture that situation. You don't want to start doing any type of detoxification, and even doing a detox in general. I have videos on that. There's the right way to do it, but you want to do it so you don't get sick. So you want to learn from the mistakes of others, including me. And I mean, I was sick in bed for 2 weeks unnecessarily by just doing a detox. And this also relates to the next one, number five. You doing like a shotgun effect on your immune system, like taking every single known remedy demand for an infection, just tons of stuff. You're going to overdo it. You don't need to do that. Yeah, even sometimes when they have like a sinus infection, they'll start doing colloidal silver as a nasal rinse, and then they'll add hydrogen peroxide, and then they'll add other things like garlic. It's going to irritate your tissues. So you got to really be careful not to overdo it. I have videos on this of what to do. Probably the three essentials would be zinc, a natural form of vitamin C, and vitamin D. And also apple cider vinegar is a nice one as well, because apple cider vinegar stimulates the phagocytes. So it can stimulate the immune system to kind of clean things up. And number six, and I've seen this mistake quite frequently, is just trying to suppress the immune system when it's trying to work right away. So there's a lot of medications that suppress a cough or suppress mucus, right? The cough and the mucus is there to get rid of the virus. So you start suppressing things, you push them deeper into the tissues, and now you have the infection longer. So anything that can actually help get rid of mucus and help it drain, or even improve a productive cough, would be a good thing. There's another point about cortisol, and even sometimes people have to take prednisone when they're sick. Prednisone is a synthetic cortisol, and cortisol, which is a stress hormone, suppresses the immune system big time. It basically makes your immune system paralyzed. It lowers white blood cells. What am I talking about? I'm talking about anything that stresses you out when you're going through a viral infection or even a bacterial infection. Boy, that is a big problem. That's probably the biggest problem. In fact, there probably wasn't a time that you got sick that you didn't have some stress event that occurred just before that. So it's very, very important to keep your stress to a minimum, get plenty of rest, take hot baths, nurture your body. But I just wanted to create this video to increase your awareness on these key factors. Now, there's a lot of other things that you need to know about the immune system. And if you haven't seen this very important immune video, I put it up right here. Check it out.